When the next pandemic hits, and sorry, yes, there will be a next pandemic, what wisdom will we have gleaned from the drama and trauma of COVID-19? One of the things that we don't appreciate very much until it happens is that new infectious diseases have emerged throughout the history of our civilization. They're doing it now and they will always do it, a reflective Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told the Naval Academy Foreign Affairs Conference as he contemplated pandemic lessons learned on April 6. A century ago, there was influenza. Then came HIV, Ebola, Zika, H1N1, COVID-19. At the end of the day, the lessons you learn about mistakes that have been made, miscalculations that have been made, it's very much like war. When you go into a war you have a battle plan, and then when the bombs start going off and the bullets start flying, the plan doesn't mean very much, he said. It's the same with an outbreak. You really need to be prepared, but in addition to preparation, there's response. And that's the thing, hopefully, we've learned a lot about over the last 14 months. Unfortunately, there's much to lament in the nation's response to COVID-19, many said. We have a common enemy, it's called SARS CoV-2, and why we're fighting against each other instead of fighting the common enemy I don't understand, said John Swartzberg, clinical professor emeritus in the Division of Infectious Diseases and Vaccinology at UC Berkeley. A study in the Lancet found that about 40% of deaths in the United States could have been avoided if we had had a decent administration that just followed the science and public health guidelines. I think it's probably closer to 60%. That's hundreds of thousands of lives. It's just tragic. Dr. Kevin Schulman, professor of medicine at Stanford University, has traveled to Washington, D.C., with his students to meet with political leaders of all stripes, as well as with Fauci himself, to learn about what might be coming and what's being done about it. We saw slides of emerging and reemerging infections and diseases long before COVID, and how the government was trying to think about responses, Schulman said. We need to understand this is not the last pandemic we're going to see. We need a comprehensive after-action report, figuring out what worked and what didn't, so we're better prepared for next time. Consider this an early draft of that report. Great leaps forward often spring from painful experiences such as this, and not just those involving science and medicine. Look at 1918 pandemic. A lot of very positive things came out of that, Swartzberg said. It accelerated women's liberation, the right to vote, by an entire decade, and I think we can anticipate a lot of salutary changes from this pandemic as well. And the science. We've accelerated science by an entire decade in 1 year,